I'm not the house of cards that falls down easily. Oh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristina Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all, we promised we'd be cordial.
Hello, listeners. Welcome to this episode of Be Awesome. Joining me today is someone who I absolutely adore. She is a colleague, she is a friend, and boy, are you going to be impressed. Elizabeth Belliveau has her LICSW, so she's got her master's in social work, and she's a licensed independent clinical social worker. She has a practice and has experience in a wide variety of settings, including residential programs with adolescents, juvenile justice, school-based counseling, outpatient therapy, and in-home wraparound services through the CBHI model. She's a graduate of the College of the Holy Cross and Boston College Graduate School of Social Work, and her practice embodies a client-centered, holistic, multifaceted treatment approach that encourages achieving full functionality in life, which, as you can imagine, is absolutely why we're going to be talking today. Elizabeth specializes in helping clients achieve sustainable change for their lives. She's done a lot of advanced training, including DBT, which is dialectical behavior therapy, CBT, cognitive behavior therapy, EMDR, eye movement desensitization reprocessing, I think that's what it is, ARC, TFCBT, trauma-focused CBT, and therapeutic yoga as well. She's got so much experience providing consultations and clinical supervisions to practitioners and advising on program and service development. She has presented all over the place. She is a faculty member at Bay Path University Graduate School in the Clinical Mental Health Counseling program, and also at Mount Wachusett Community College. She also is an internship supervisor for local MSW, Masters of Social Work students in the Worcester area, and she's a board member of the NASW Central Region and the Rise Beyond Foundation. She's also a Reiki practitioner. That's a lot. Talk about an intro. So glad to have you on the show.
So glad to be here, Kristina. Thank you so much for having me.
This is a delight. So when I listen to all of that, and I know what those things mean, but maybe some of our listeners don't, what's sort of the focus of your clinical practice and why?
That's a great question. And it's interesting. That's something I talk a lot with students about. So when I started my career, I spent a lot of my time working with teenagers and with children. And as my career has evolved, my practice has encompassed also treatment of adults. And what I've really found is that, the predominant kind of presenting issue that I treat is trauma in multiple forms, whether it's with the first responders that I work with, police and EMTs, and doctors and nurses, or, children and families, people going through loss, and that it was just really important to understand how trauma affects people over the lifespan, to be able to have a practice that could, provide quality care for people within a variety of age groups.
So one of the things that I hear people talk about is sort of big T trauma and little t trauma.
Yeah.
What's that all about?
It's a great question. So I always like to kind of work with clients on understanding that there's kind of two roads to trauma. The first is this idea about, your day to day and your functionality. Little T traumas are things that could happen that trigger those bigger things that have kind of plagued you for long term. And then there's kind of these big T traumas, major things or major patterns in your life that have kept you from being able to achieve your full functionality, that have kept you kind of stuck in thinking patterns that aren't helpful or supportive for you. So a lot of times what I think brings people into treatment is actually little T traumas. Little things will happen. People will come into work and they've had to therapy and they've had a fight at work, or they've had disagreements with a spouse, or they find they're just not able to keep and sustain friends. And really what we get down to is that there's kind of all these little T traumas that are leading back to this big T trauma. And I usually use the analogy for people of a tree. If we spend all our time pruning branches and we've got rotten roots, we're not going to really have much of a strong tree. So at some point we got to get to that big T trauma, which is the roots of what's really going on.
From your perspective, do you think that people are always aware that they've had a big T trauma in their life?
No, absolutely not. I find this is true, especially with childhood trauma. When we think about our childhoods and when we think about our experiences early in our life, that's become our norm. So a lot of times, especially when people have kind of had chronic trauma as a child or as an adolescent, it's not until they're adults, or sometimes not at all, that they realize that some of the things that were going on in their life were atypical. Some of the relationships weren't healthy. It's really interesting. Way back when I was in graduate school, I had a professor that would talk to us about the book, I Know Why the Caged Bird Sings.
Mm.
And what she would talk about was that, if the bird only knows the cage, that's become the bird's norm. But it's still going to affect how the bird functions. And for me, I think about that a lot when I think about childhood trauma. Even though that became the norm, that unhealthy environment became what the person was used to, at some level, it still negatively impacted their development. And a lot of times as they get healthier, they work on little T trauma, or, they just evolve throughout their lifespan, they start raising all these questions as to, is what happened to me okay?
So, what's interesting? This is making me think of something which it literally has nothing to do with trauma, but I think that it's a related example to what you're talking about. And I'm just so struck, and I think as well a lot about the idea of you only know what you know in the context that you know it.
Yeah.
So, when I was all the time growing up, this is going to be an interesting subject to throw in here, but I would have really, really significant menstrual cramps. And way later in life, I had a cyst on an ovary. So I was talking with a surgeon because she was going to have to remove it. And I said, gee, do you think I have endometriosis? And she said, there's no way. And I said, why do you say that? And she said, because you would have had really, really bad pain whenever you were menstruating, and it would be all over your record. And I didn't say anything then, and I left. And then I was thinking about it. I'm like, well, I did have pain, but why would I ever even talk about it? Like, because everybody talks about, oh yeah, you feel uncomfortable and you have pain. So sure enough, they did the surgery, removed the ovary. There was tons of endometriosis and adhesions and all sorts of other stuff. And so it was only later, after she found out, she's like, oh, I guess you did. And I'm like, huh. So it was really striking for me. I know it's an odd example, but I had no idea the context of the pain that I was feeling, because people said stuff like, yeah, you'll have cramps and that will hurt. But how do I know what my hurt is compared to what everybody else is
Like, I
talking
think it's a great example, and I think it's so accurately is reflective of the individual's experience with early life trauma. But just as I always think it's important that we remember two things. Number one, as people, we are built with resilience. So at some level, just like you were able to kind of, cope with the cramps, people early in their life, they find ways to cope within the trauma, sometimes more effectively than others. But just as we're wired for resilience, there is this piece about shared human experience around health, and I think, wellness. And I think that a lot of times when people, grow up and they're talking about, especially, prolonged childhood trauma, they'll say things like, I didn't know why I felt like this. So they may not be able to identify
Hmm.
what happened was traumatic. They are able to identify that they've had these long-term symptoms. They've had these long-term questions, about how they've been feeling and how they're able to kind of function. And, I always talk about that's kind of our body and our mind's way of having this, alert, alert, red flag, something's not right. We may not know exactly what's not right, but something doesn't feel right.
Which leads me to another area. So, as we're thinking about this, I think perhaps as people begin to be willing to look at these things, they may say, okay, I recognize ABC event occurred, the kinds of things that we regularly associate with a big T trauma. I experienced a sexual assault, my house burned down, whatever. I was in a major bus crash, things like that. What do you think about, or how would you define some of the other things that really do count as big T trauma, but are harder to identify?
Absolutely. So one of the things I see a lot in my practice is this idea about relational trauma,
Hmm.
about the trauma that comes within our interactions and our relationships within life. The other thing I think is really important to remember about trauma is that we get stuck in this mindset that we all have to agree about what a trauma is. But really, when you think about what trauma is just the brain and the body's inability to effectively process and kind of file away an experience for themselves. So, you and I could be in a car together and driving to, let's go get coffee, and we're in an accident. And the next day you wake up and you might say, wow, I'm so lucky to be alive. This has found this renewed sense of purpose for me. I can't wait to kind of bring with me all these new revelations I've made based on this life-changing event. And you go about your way. I could wake up and, experience anxiety and debilitating panic and not be able to get in the car, and not be able to drive again for months and months. And, we've had the same experience, but our bodies and our minds have processed it totally differently. So sometimes, as silly as it sounds, the actual event matters very little. It's about the individual's kind of processing and reaction of it. I have kind of an interesting story of a woman I treated a few years ago. Interestingly enough, she was a therapist herself, and she had some pretty significant lifespan trauma. So some really, really significant events in both her childhood and her adulthood. And for her, she had been to like 15 therapists over 3 years. And really, what was kind of turning her off from the therapeutic process was that she would go in for these intakes or the first initial sessions, and they'd say, have you had any life trauma? And she'd, force herself to tell them and get totally triggered, get totally flooded with, trauma symptoms, be unable to function for a couple of days afterwards, and not return to treatment. So she was kind of stuck in this cycle. And she did a really nice job coming into treatment with me and telling me that that had been her cycle. So we kind of changed it up a little bit. I said, okay, let's focus totally on symptomology and let's come up with a code word for the event, right? And so for her, the code word became this word spider. So we had this context to be able to talk about the event without kind of doing this re-victimization through, trauma narrative and storytelling before she was able to do it. And it took her about a year and a half to be able to kind of actually do that narrative piece of her work. But she made really effective progress talking about symptomology, and distortions and self-safety and resiliency prior to that. So for me, it was just this really great case example of how we have to remember that sometimes it's not about the event, but really focusing it on the individual's experience and interpretation of it.
I think that that is a fabulous example. Thank you so much for sharing that. And as you know, I'm also a practitioner, I'm a
Yeah.
psychologist, and I have a specialization in working with people with DID, dissociative identity disorder. What, for listeners, that's what people used to call multiple personality disorder. And one of the things for me that's been so important in focusing in this area is that there's guidelines that are put out on how you work with someone. And
Yeah.
it's all about safety first. And so I have people with DID that I've worked with where we, years later, have still not gotten to the narrative of the trauma
Right.
very specifically, because there's so many other things that we're dealing with in terms of the person's internal sense of safety, their external ability to keep themselves safety, the ability to return, as you put it, to functionality. And I know that when I was in grad school initially, the training that we received was you have to do that, right? You have to go through the trauma narrative and you want to do it fairly soon. And that the person's going to have this ab reaction. They're going to go through it with you in a safe space and then they'll be able to move on. But we don't think that way anymore. Right now we're
No.
like, wow, no, like you're making it worse, actually. That there's this myth, I think, that still exists. And I want to just highlight this for our listeners, that you do not necessarily have to go through the narrative at all, certainly not right away.
Absolutely. Absolutely. I think, it's been why, some of the more postmodern models of trauma treatment have been so helpful, I think, in a lot of our practices, this idea around building skill building around self-care and emotion regulation and competency work and self-esteem, um, and interpersonal intelligence and social skills and all of the other things that allow us to process trauma and to live a happier, healthier, more well life, that don't necessarily include talking about the worst day or the worst period of your life for a prolonged period of time in the treatment context.
I have people who come in all the time and they still have this idea that if you're going to go to therapy, it means that you have to go sort of dig around and replay everything from your childhood. And sometimes they'll come in and say, I don't even remember anything. I'm like, I don't want to do that. I'm like, yeah, that's cool. Like, so
Yeah.
for me, I tend to think of it as the stuff that's gone on in your life up until now is information. We don't
Yep.
have to go over the details of any of it. Although I do think that in terms of an understanding, and this is literally, this is, I think, what you're talking about, and also one of the things that matters to me is when we know, or we can say, A, B, and C kind of things have happened. If the person isn't making the link to how that's impacting them today, then that's a piece of information and it gives them a sense of cognitive understanding. But it doesn't necessarily mean it changes what the trauma symptomatology is in their body.
Right. I couldn't agree more. I also think, in my own work, and I think a lot of people's work, I think there's a difference between having people relive their trauma narrative, but also, letting people kind of tell you their life story.
Mhm.
There's a lot of other things that go on in people's life that shape who they are and who they've become, bringing them to that day in your office that doesn't include the worst day of your life. I have a colleague I work with who, has a wonderful way about doing these really rich, like lifespan work and timelines with clients. That doesn't just talk about kind of the tough parts, but what she calls, these life rafts, for people. Where were the points of resiliency? And I think, in our field, as we've switched from being a focused field to being a resiliency and strength focused field in practice, it's such a nice way of kind of envisioning, what are the things that allowed you to get out of bed every day? What are the things that have allowed you to keep coping and keep kicking and brought you here today?
Exactly. And I think so often people that I hear say stuff like, oh, well, like that's just what I have to do, or everybody does that, or that doesn't really count. And really helping people to recognize that those things count as much, if not more, than anything else that they've done.
Absolutely. Absolutely. I had a woman in my office this week who'd suffered a tremendous loss and was really feeling kind of down on herself around her ability to kind of function and cope right now. And, you know, able to kind and, needed some work and ability to kind of identify that there has been some effective coping. I mean, just sometimes getting out of bed,
Mhm.
every day after you've experienced a tremendous loss or trauma is success in itself. And I think that sometimes, just as we have all these kind of life demands, put upon us, people sometimes don't realize the importance of recognizing the small successes. Just as we have big T and little T traumas, I like to say we have big S and little S successes. We have those big moments, those revelation moments, and those big healing moments that can be big S successes. But there are all these little S successes that clients have every single day, whether it's the ability to maintain a job, or to learn new effective strategies in their relationship, or sometimes stand up for themselves with those toxic people in their life. These are those small moments that add up to really facilitate change.
Absolutely. The other thing that I talk to people a lot about is what are their core values? Because everyone has them, and we can also sort of choose, I believe, to say, okay, X has been a value, but maybe I want to live my life differently. And so one of the ways that I talk to people about their life and how they can see those successes is, and the context, particularly in terms of relational issues, is to say, so what are your values? And understanding where that comes from. And then looking at other people who, even those who may have sort of done them wrong, and say, what were their values? And so if we come from that perspective of compassion and understanding people's values and also their limitations, both the other person and the client, then we can have I think, a way of talking about this that's a little different, and it gets away from they're bad. Because particularly I find in relationships, people don't want to reject, nor do I think they should reject the other person necessarily in this kind of relationship trauma.
I would totally agree, and I think that a lot of times for people, I say this all the time in my practice, there are no absolutes when we're talking about trauma. A lot of times when people come in, especially people who have been victims, a lot of times their perpetrators have had multiple roles in their life. And one of the things I work a lot with families on is that if we have a child who, is processing some trauma and is, trying to recover from, let's say, some sexual abuse, and took place at this somebody that the family knew or was close with, for that kid, that person isn't all bad. And
Mhm.
that can be a really hard place, I think, for parents to get to. That there may be 10 horrible memories from this child, but this child also has these memories and these moments that they at the time still identify as really positive experiences for them with that person. um, and I think that sometimes that can be a real hurdle, especially when you're working in family work within trauma. I do a lot of advanced training in trauma. And it was really interesting. A couple of years ago, I went to a training run by a woman. She was I'm drawing a blank on her name, but she was a phenomenal therapist, and she practiced Buddhism and was practicing in East Asia. And one of the things that she talked about was the value set of working with people who
Mm.
still have love for the people that have caused them trauma in their life, and how we teach people to sit and tolerate that you can hate someone and love someone at the same time, and you can be angry at someone and love someone at the same time. And that sometimes that love comes from a place of resiliency, that we're able to kind of tolerate that because we are so resilient, because we are so functional, because we're able to see kind of duality there. I work a lot, especially with parents of children, by saying when your child talks about still feeling for their victim, their perpetrator, it's less of a statement about who the perpetrator is and more of a statement about the health of your child, and the health and the ability for your child to recognize duality and say, what happened to me wasn't okay, but I don't feel vengeful. I don't feel, the kind of, anger that I think you're looking for me to feel.
Mhm.
I think that's a lot when, especially in the court system, when we're asking children, do you want to make a victim impact statement? I have found in my practice very, very few children come forward and say they want to see significant penalties for their perpetrators. And a lot of times it's parents that want to see that, because children at their core don't want to see people punished. And they're able to recognize their own pain and to process through their own pain without that piece of vengeance. I believe that's one of the things that makes children so resilient.
Yes. And I guess it's also fair to say that it's not wrong for someone to say, I want a perpetrator to be held accountable. But I
Not
think what you're really highlighting is the difference between accountability and vengeance.
Absolutely. Absolutely. And I think part of trauma treatment a lot for people is recognizing that people need to be accountable. I can think of a case I work on right now. The child had some, interfamily abuse. And for a long time, this child had this fear. She was really stuck on this idea about the fact that her perpetrator was going to serve jail time. And the family was really struggling with why this child didn't understand that. Well, shouldn't she want him to go to jail? He did horrible things. And really what she said was, from what I've heard about jail, it sounds like a horrible place. I don't want anybody to go there, but I also know that he's not safe and that he can't be around people anymore. And for me, that's exactly kind of what you're talking about here, Kristina. It's highlighting that I don't feel the need to punish other people to heal myself.
Well, and that really gets us, I think, back to this idea of being able to treat ourselves with compassion and
Yes.
ourselves with forgiveness. And not that we are responsible for what has occurred, but I think so often those who have experienced trauma, big or little t, blame themselves.
I would say almost all the time. It's one of the places that I think people get stuck.
Now, you are also a Reiki practitioner. How does that work with your clinical practice?
So it's really interesting. So just to be clear, I don't use Reiki within clinical sessions,
Mhm.
but years ago, really in reading about some of the effectiveness of energy work, I felt the need, for myself as a practitioner that primarily has dealt with the mind and the body prior to that, to really, delve into kind of studying that. And I, did some advanced training in Reiki and really found not only some incredible benefits with myself, but that, people were really reporting, feeling unstuck from Reiki. And that, I'm a huge proponent in energy work for people. My practice incorporates, mind, body, spirit practices. And I think it's important to, not only be able to practice in multiple domains, but be knowledgeable in multiple domains in terms of how people heal and what works for people. When I opened Enlightened Interventions, one of the ways that I envisioned the practice was this big buffet table of wellness interventions, and that people could kind of come in and pick and choose what they wanted and was going to work for them. And to be honest, as I'm sure Kristina, talk therapy doesn't work for everybody. There are people you know,
Yeah.
that can get just as good healing for themselves through yoga or through a reparative relationship or through a Reiki session or fill in the blank. Therapy is one of the ways to heal. So for me, it was kind of, testing the waters and having a practice that tried to incorporate lots of different ways to facilitate healing for people.
I'm right there with you. I've gone through yoga teacher training and was a yoga teacher for a number of years. I've also gone through Reiki training. And I think that it's important for us to really recognize that not everyone comes to healing and functionality in the same way. And
Mhm.
as well, for me, I think, I'm very aware of the idea that there have been indigenous practices over the world that we here in the West have been a little slow to
Absolutely.
to recognize, and yet there's so much benefit. I'm like, wow, when there's centuries of healing that has been so effective, isn't that something that, from my idea, that we want to actually add? Like, why wouldn't we want to have, as you put it, a wider buffet of services?
Yeah. And I even think if we think about our own lives, like I think about my own experiences in my own life. I think about a time when I was in college when I really was very unsure about kind of what I wanted to do professionally. and was really confused. And I did an abroad experience and was really kind of changed and transformed by that and got a lot of clarity from that. And it was interesting. I was speaking a few months ago and I was talking about that experience, and someone said, "Oh, that sounds so similar to when I saw a career coach." Somebody else said, I've done a lot of journaling around that in my own life. And I thought to myself, here are these three multiple, interventions,
Mm-hmm.
self-driven or professional and formal support driven, and it all gets the same outcome. So, we really have to understand that people heal in all different ways.
Absolutely. And that this is not at all connected to that, but it just prompted a thought because we've been talking about trauma and healing. So, what do you think about bullying as a source of trauma?
Um, Absolutely. I think sometimes, bullying, I think, can be kind of linked in with this idea around relational trauma.
Hmm.
And I think bullying can be, I'm going to say a couple of things about it. I know there's been a lot of talk around people's misuse of the term bullying, but I'm sure you've seen it and I've seen it in my own practice. Both adults and children who have been, victims of kind of this pervasive pattern of victimization and bullying, either at workplaces or at school, absolutely have significant trauma symptoms from it. Um, and I think sometimes relational trauma can be some of the most damaging and the most difficult to recover from. As human beings, we're social beings. We're created social. We strive and we crave relationships. So when those break down, whether it's through the inability to understand at 6 years old why somebody doesn't want to be your friend, or by being, pinpointed and victimized at work, it can be incredibly painful for people.
Absolutely. And what that makes me think about is these days, there's a lot of talk about narcissism and people who are narcissists. And I think that there's legitimate concerns about that. But, one of the things that we'll see in a relationship with a person who has a very significant narcissistic traits is actually this pervasive pattern of bullying and control. you know and
Yeah,
I think that it might help us to make that link more explicitly. We've sort of I love that you mentioned the workplace because our focus on bullying has been in children and schools, and that's great. I am all for that awareness and really looking at that, but it's also something that adults are subject to. It doesn't just end when you graduate from high school.
absolutely. Absolutely. And I think it's so great that you kind of pulled this into this idea about control, because bullying is about control. A lot of times when you work with bullies, because, as professionals, we work with people on both sides of the bullying equation. We're finding that these are people that have significant issues of needing control in their life. They're feeling out of control in a lot of areas. They don't always have the most intact self-esteem.
Hmm.
Uh, so that there's definitely this need to kind of control and take control over somebody else's mind, and sometimes even their body. When I've seen kind of that physical piece be included in the bullying relationship. Um, it's really interesting. You brought up the idea of narcissism. I was reading this week about, the selfie generation, and, are we building narcissists? And what do you think about that?
You know, that's interesting. I think that we've got some concerns about digital media use, obviously. And I think that you said before, we're social beings and we have to make certain that we connect with other people. I also do think that there are ways in which even when it's digitally, that is connection. I'd love to see more face-to-face connection, but by the same token, I have relationships now with people all over the world that I'm able to do through digital media, and they're really important relationships. So I don't think that it's an either or. But this idea of taking selfies, you know, suddenly there's an opportunity for people to put themselves out there and to curate how they put themselves out there that did not exist when you or I were growing up. And what I have is a lot of compassion for people who spend their time making sure that they're using filters and getting just the right shot. Now, I've certainly taken selfies of all sorts of things, but it's typically because I'm so delighted in that moment, and it's more something that I want to capture and share. And I think that there's potentially a different I'm certainly not sort of doing my makeup, making sure it's the great shot. I'm like, look, this is fabulous. And so I make a differentiation in my head. And I think that it's really easy for people to then make a sweeping generalization and say, oh, well, all anyone is doing is self focusing.
Yeah.
But the other side of that is what I do see, and I think is problematic, is the comparison. So my issue is almost less with the person taking the selfie and more this sense of very deep concern and compassion for those who look at that and say, oh, they're doing this, this, and this, and I'm not, and get into that self-negativity.
Yeah, I would agree with you. I think it's really interesting. When I work with women a lot, adult women, teenagers, young girls, I love working with women. And, I think that it can be a tough time to be a woman right now.
Hmm.
And a lot of times what I'm finding is, especially young women who live in kind of the selfie generation will talk about feeling the need to partake in it on social media, on different platforms. And then the mixed responses, everything from, I've had teenage girls get called a narcissist, or, oh, you're selfish, or you're self-centered, or you're all about yourself, or full of yourself. But then on the other end, we read articles about mothers and, encouraging mothers to take photos with their children because, children don't have any photos of their mothers because their mothers are always the one taking the photos.
Exactly.
you
Right.
know so it's just such a mixed bag. And I think that one of the things when I talk about this something as simple as selfies, but the bigger picture about celebrating yourself and how you celebrate yourself, people do it in a variety of different ways, and it's totally okay. It's whatever works for people. But I agree with you, it's when it becomes that obsession, or when it becomes that comparison piece of, well, I don't have the purse that this influencer had, or I didn't look like this. That's when it becomes something that's not so positive in somebody's life.
And so I think, like everything, there are multiple perspectives on it. And where I think we get into trouble is when we say there's only one way to look at anything, because
Yeah.
no matter what it is, we can use to our benefit in a more neutral way and to our detriment.
Yeah, it's interesting. I had a teenager in my office a couple of weeks ago. And she's, very, like they all are, very into Instagram and, different platforms. And she's really into that new singer Lizzo, who's all
Yeah.
over the radio and everything. And she was talking all about her, and she's, was talking about how, this woman is very body positive, and, very pro female and very positive. And she's like, oh, I love going on her Instagram and seeing all the photos she posts of herself, that, she said, it's nice to see somebody that looks like me, and, and hear from somebody who's, not ashamed. And I think it's an example, exactly what you're talking about. It can be used for a positive piece. And it can be used as a way to feel good about ourselves and to find other people that look like us or sound like us, and to normalize sometimes our own experiences in the world.
Absolutely. I was thinking about something that we were saying earlier, and I wanted to just make one comment, because we've talked a lot about relational trauma. And one of the things we talk about in the medical world are sort of things that are overtly problematic and then hidden illnesses. So when we see someone they're on crutches, or they have a cast or something like that, everyone can see automatically, oh, look, there's something going on for that person. And yet we've begun raising in the last couple decades awareness of the hidden illnesses that go on for people, which could be physical, could be mental health. And I think of relational trauma in the same way. It's still sort of in that hidden, in many ways, aspect, in that people have this idea of the false idea of the white picket fence and the family, and sort of this leave it to beaver kind of way of thinking of how a family should be. So someone may recognize that that wasn't it, but understanding the ways in which relational trauma exists and is a force for people, I think we need to be bringing that to the forefront more in the same way that we've done medically for some of the other illnesses that go on.
I think it's a great point, and I think they're hidden illnesses, and things that you can't see is really something we need to be talking with people more about. I think, you brought up the idea of compassion earlier. What we know, from people who have done work on this and even team building work within school systems is that when you raise those hidden illnesses or those things that you don't see about somebody, our compassion, our connection increases between people. But I think there's been stigma around hidden illnesses. I think that we have a hard time understanding things that we can't see, and we have a hard time understanding things that we can't necessarily relate to. Uh, and that can be from everything from it didn't happen to me to I had it worse and I turned out okay. Why is this so bothersome for you? And I'm sure you do too. We see this all the time in our practice.
Yes. Well, or the other side of they had it worse than I did, and therefore what
Yeah.
I went through doesn't count.
Absolutely. The negating yourself,
Yeah.
I think sometimes that's some of the early work that we do. Even though people may not tell us their story, we still do work around empowering themselves, around they still have a right to their story. I worked with a woman once who had some pretty significant interfamily abuse go on, and she was the youngest. And so by the time she became a certain age, the abuse had decreased a little bit. So for her, she had a really hard time rectifying within herself this idea that my sisters had it worse than I did, so I don't really have a reason to be in this pain that I am,
Yeah. Yeah. Right. XYZ didn't happen to me in the same way, so I
Exactly.
should shut up and suck it up.
Exactly. And some of the early work that we had to do was validating her own experiences.
I know that we're just about out of time, but I did want to mention, because we work together on this, but would you like to say a word or two about the trauma certificate that's part of
Yeah.
BayPath? Because I think that's super exciting, and you're one of the main motivators for this.
So I'm so excited about this. So myself and Dr. Mark Benander and Professor Melissa Petrillo and Kristina and I really kind of saw a couple years ago the need to train practitioners in our field from a trauma-informed lens so they could go out into the field and, make sure they're doing this really great trauma-informed work. So people are getting, the best quality care they can possibly get. And this year that has come to fruition, and we are launching our advanced trauma certification within our LMHC program at BayPath University with a bunch of really dynamic core courses that we're so excited about. And I think that this has been probably one of the most exciting things I've gotten to do in higher ed. Would you agree for yourself too, Kristina?
Absolutely. So which is the course that you're putting together?
I am doing the advanced clinical skills for the treatment of trauma, which I'm so excited about. My course gets to cover everything from treating first responders to intergenerational trauma, to big T little T trauma differentiation, to more chronic and relational trauma for people, and developmental chronic trauma within the context of developmental trauma. So really getting to do some cool stuff.
I'm super excited about that. I think that is just so
Yeah.
fabulous. And ironically, I think we've sort of touched the teensiest bit on many of the topics that you'll be going into in depth in that particular course, as well as what are the treatment strategies for that.
Absolutely. I always tell, new students and my students in the program at BPATH, the world of trauma treatment is very gray and we're evolving all the time. And I'm so excited that we have a program to kind of make sure that we're teaching the newest trends, the newest findings, and teaching trauma-informed practitioners who can go out and treat people with compassion, and help people heal and become who they need to become.
I'm as well super excited about it. I just think it's a great opportunity. I'm actually going to be, for the first time, teaching one of the core courses in that track this spring, the neurobiology of trauma.
That's so great. I love the description of that course. I'm super excited, for people to understand the brain and the impact of trauma on the brain. It's just such an important place to start with our understanding of trauma throughout the lifespan.
Absolutely. I worked really hard to try to find all sorts of different media as well, sort of videos and readings, and so professional journals, and then things that are more accessible for people and infographics. And, as much as I knew beforehand, literally putting this together has just made me realize how much more there is for me to learn and how much in infancy we still are with understanding the brain.
Oh, absolutely. I would totally agree.
It has been such a pleasure having you on the show. This is
Thank
fantastic.
you so much for having me. And
This-
tell everybody out there who's thinking about becoming a practitioner that we've got a great trauma program and we hope to see you there.
Absolutely. And would you like to say anything about your practice?
Sure. So Enlightened Interventions, we have 2 locations, one on Mashpee on the Cape and one in Worcester. We're accepting new clients at either location. I'm very, very proud of the exceptional team of clinicians that we have working there that are doing really great work. And please feel free to reach out if you need anything.
Wonderful. Thank you so much. It's been fabulous.
Thank you, Kristina. I'll talk to you soon.
Okay.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it, but how opposing.
Good boy.